VP Mike Pence and Speaker of the House Nancy Pelosi are among the first to receive COVID-19 vaccines, and the internet's got a lot of feelings to report about this. It's Andy here to break down everything you need to know about your vaccines because they're really important right now, especially in the world of COVID-19, and people all across the internet are having their field days, feelings, whatever you want to call it, about Nancy Pelosi, Mike Pence, all these people in Congress who are getting the vaccine before anybody else. So let's break it down. On Friday, Pelosi and Pence received the Pfizer-BioNTech vaccine live on TV to convince Americans to take the vaccine as well. Now, I've seen a lot of posts about this. A lot of people were up in arms that it was made a televised event, so let's just continue. And many people were frustrated that Pelosi and Pence were among the first instead of other groups of American citizens. One Twitter user said, "I love how they are spinning this as representatives showing us the vaccine is safe, when in reality this is showing us who is/will always be first in line for all forms of medical care on our dollar and the expenses of our lives." Someone else said, "Why do y'all get the first and not hundreds of essential workers constantly exposed to this stuff?" People called out Pence in particular because of how much he and the Trump administration downplayed the pandemic. One tweet reads, "We live in a system where the people who most fervently denied and downplayed the coronavirus are among the first to receive the vaccine. This is so despicable." It's understandable why people are upset. I mean, why wouldn't you be upset? But let's get the full picture about why they did this. Politicians are not the only ones getting the vaccine. The CDC recommended that healthcare personnel and long-term healthcare facility residents should be offered the vaccine first. Plenty, but not all, healthcare workers and long-term care residents have received the vaccine so far. Representative Alexandria Ocasio-Cortez did an informational Q&A on Instagram showing the process of how she got her vaccine and answered people's questions. When asked about why she got vaccinated before any healthcare workers, she had this to say.
I was actually surprised by this too. I was expecting we were going to get it a lot later. And healthcare workers, for the record, healthcare workers have started to receive it. Not everybody obviously yet has been vaccinated, but when it comes to Congress's access, it's due to something, continuity of governance planning, which is essentially national security planning. So this actually came from a national security policy and directive to ensure continuity of governance during national emergencies.
Now, if you didn't know, continuity of governance is a principle that ensures the government doesn't shut down so that it can continue its essential operations. So government officials like Pelosi and Pence were given the vaccine because if a majority of the government officials contracted COVID, which would force them to stay home and quarantine, the government wouldn't be able to operate efficiently during these troubling times. The vaccine has been made available to Congress members such as Representative AOC or Senator Marco Rubio, White House officials like Pence and members of the Trump administration, and the judiciary, such as the Supreme Court justices. Now, I have seen a lot of people on Facebook post about it. Even myself, I posted about it. But let's talk about when you and I, many people alike, will get the vaccine as well. Right now, healthcare workers, people living or working in nursing homes, and government officials are receiving the vaccine. Next in line will be essential workers, most likely teachers or employees at grocery stores, retail stores, or restaurants. This is only an assumption of which essential workers will get vaccinated. It's unclear at this point whether it's an order of essential workers to get their vaccine and who really qualifies as an essential worker because that term is so broad. Really, I don't understand why the term is so broad. It's like, is this really needed? Do we need these things to survive? Food, water, atmosphere. That's my perspective. Then the other high-risk groups such as seniors or people with chronic health conditions will get the vaccine. The general public will probably get the vaccine sometime around the spring or summertime next year. Now it's a frustrating situation to be in, especially sitting here reporting to people why they can't get the vaccine, why I'm sitting at home reporting about news with the vaccine available to other people that are not us. So it's frustrating and I get it. I'm totally here to more so give some light and shed light of why we're not getting it, but also it's wrong. It's wrong why we aren't getting it, but leave us a good heads up on socials of why you think this should be something we get right now. But for more social media news daily, head to whatstrending.com. Follow us at What's Trending, and we'll see you soon.